people registered. Where? Oh, let me stop. Sorry.
Okay, we're good. We are live.
Okay, so I can start.
Yes.
Okay. Hello, everyone. My name is Evelyn Campbell. I'm a doctoral candidate at the University of Chicago. And thank you all so very much for joining us for Black and Immuno Week, where we celebrate, amplify, and support Black voices in immunology. Before we start, of course, I have to give a shout out to our sponsors. Thank you so much to the Immune Deficiency Foundation and Imperial College London. Don't forget to follow us and ask your questions on Twitter using the hashtag Black and Immuno with every word capitalized for accessibility purposes. And our presenters will be using closed captioning in their presentations, and transcripts will be made available 24 hours after the event. So that way this panel can be as accessible to everyone. So that will be available on blackandimmuno.org. So with that being said, I have the honor to introduce our panelists. First, I will be introducing Dr. Avery August. Dr. August is a Howard Hughes Medical Institute professor, professor of immunology, vice provost for academic affairs, and presidential advisor on diversity and equity at Cornell University. His research focuses on understanding the immunological basis for the balance of inflammation and pathology. Welcome, Dr. August.
Thank you, Evelyn, and thanks for the invitation to be here. I'm really looking forward to the conversation.
Thank you. Okay, next is Dr. Bianca Baker. Dr. Baker received her bachelor's degree in microbiology and her doctorate degree in immunology from Virginia Tech. She currently is the Associate Director of Medical and Clinical Affairs for Dompe Pharmaceuticals. She has over 5 years in pharmaceutical industry experience with an extensive background in medical affairs across various therapeutic areas, including immunology, ophthalmology, allergy, and dermatology. Welcome, Dr. Baker.
Thank you so much for having me.
Thank you. Okay, next is Dr. Layal Bedaiko. Dr. Bedaiko is a research fellow and head of advancement at the West African Center for Cell Biology and Infectious Pathogens at the University of Ghana. He is an immunologist with broad interest in investigating immune functions among African populations in order to better understand and address immunopathology associated with infectious and non-infectious disease in these populations. Welcome, Dr. Bedaiko.
Thank you very much. Very happy to be here.
Okay. Next is Dr. Layal Liverpool. Dr. Liverpool is a science journalist with expertise in virology and immunology. Her writing has appeared in New Science, Wired, and The Guardian. Currently, she is a trainee digital journalist at New Scientist based in Berlin, Germany. Welcome, Dr. Liverpool.
Thank you so much.
Thank you for being here. And last, we have Dr. Clef Wilson. Dr. Wilson is an immunologist and currently an industry field application scientist. He holds a bachelor's degree in biology from Alcorn State University and earned his Ph.D. in pathobiology from Pennsylvania State University, where he studied innate immunity. Welcome, Dr. Wilson.
Thank you for having me. Happy to be here.
All right, great. So now we have all the introductions out the way. I'm actually very excited to moderate this panel today because, I'm currently in the later stages of my PhD, and I'm starting to, I've been exploring various careers, but I want to learn more about, the various subjects that you all are pursuing in your career. So if we could start maybe with, describing how you got to your current career from graduate school, and we could start with Dr. August.
So the question is starting with the graduate school. So that was a while back. So I wanted to preface that by saying, conditions may have changed, results may vary. But no, this is interesting because, in the when you reach a certain stage, such as where I am, you sort of start to get asked these questions about looking back. And to be honest, not sure I can say that there was anything planned. All I can say is I took an immunology course and I was just blown away by, the intricacies of the immunology. Two things. One is the immune system can basically, evolve to respond to anything. And two, this idea of diversity of the immune system and how, in the adaptive and the innate immune system sort of has this diverse set of receptors that basically evolve to recognize things. And I think it's sort of, there are life lessons in there that as I look back, not to say I recognize it at that point, but as I look back, you sort of see in the immune system sort of life lessons. And just, I've been doing the things that I enjoy and doing the things that I wanted to do, as well as some things I didn't want to do. And then looking at, taking advantage of whatever expertise that I have and the experiences that I have to do the next thing. So it's never been, well, I'm going to do this so that I can do the next thing and do the next thing, but it's doing the things that I enjoy. And when the next opportunity comes, realizing that I've had those experiences that come to bear on the next thing. And so it's sort of a random walk, which, is maybe is one way to do things, but I'm sure there are other ways of doing things as well.
Awesome, thank you. Does anybody else want to comment on that? Your career journey from graduate school to where you are now?
I could take a stab. Mine is maybe a slightly less random than Dr. August, but still, I think at the beginning, I didn't know where I'd end up, and I still don't think I've ended up yet. So I'm probably a little bit younger than Professor August. So, it's not looking back quite as far, but I am beginning to feel my age even now when I interact with students. I'm like, wow, these people were born in 2000. That's crazy. Anyway, yeah, it's terrible. But anyway, my journey into immunology started in undergrad. So I did my undergrad at Calvin. Well, it was Calvin College then. Now it's Calvin University in Grand Rapids, Michigan. It's a small liberal arts school, but with a really good biology department. And I had fantastic immunology teachers. So even as a freshman, I started doing research as a freshman. I'm Ghanaian. I came from Ghana. That was my first time in the US. But I had a professor who really took an interest in me. Sadly, he's passed away now, but he gave me a shot to do summer research as a freshman, which is almost unheard of. I was this kid from Ghana who was good at biology, but hadn't really done much by way of research. So he gave me a shot in his lab for the summer. I really enjoyed it. I was working with macrophages, phagocytosing stuff, and it was like, wow, okay. So I did that, and that basically opened up a doorway for me. I did research every summer after that. My sophomore year, I worked with him again. Junior year, I got a summer fellowship to go to Fred Hutchinson in Seattle. So I had my first taste of like hardcore sort of academic / private research. And then in my senior year of college, I had the chance to do research at Van Andel Research Institute, which is a large cancer research institute in Grand Rapids. And by then I knew I had to get a PhD. There's no two ways about it. And so I took a gap year, worked as a research technician at Van Andel, just to sort of recharge my batteries and take my GREs and all of that stuff. And then I got into Northwestern in Chicago. So the other place in Chicago, not you Chicago like Evelyn, but that's all right. So I did a PhD at Northwestern in immunology and microbial pathogenesis. And my journey there, even I would say, was a bit meandering. I ended up working in 2 different labs. Started in one lab working on malaria. I'm from Ghana. I had malaria several times. I was like, it's perfect. I should study malaria. But as I'm sure many of us know, grad school doesn't always go as planned. And in the end, I switched labs and actually started all over again. So I had to do a qualifying exam. I had to do my quals all over again. It was. Now looking back, it was great for me. At the time, I didn't think so. But I ended up in a T-cell immunology lab where I was learning, how T-cells develop. So it was basic T-cell development, focusing on T-cells, particularly that work in infectious disease. So CD1 restriction, M3 restriction if you're in mice. And that really gave me a solid foundation in immunology. And actually, my supervisor had just come from University of Chicago. So anyway, so that really broadened my base. The malaria lab gave me a taste of infectious disease research, but it was more of a cell biology than the immunology lab. And then I went to this really fundamental immunology lab But then after my PhD, as a Ghanaian, as an African, I didn't want to stay in America forever. I'd spent at that point 12 years in the US. So I began to look for postdocs outside of the US. And so I got a postdoc in Kenya at a really great place by the beach. I mean, I can't think of better places to do research. So it's like on the coast of Kenya, near Mombasa, really first class research.
Shoot.
Sorry?
I'm trying to figure out how you could concentrate on doing
well, I mean, yeah, I guess. You pretend you close your eyes and pretend that the beach isn't right just there, but at least you have something to look forward to. So 5 o'clock, yeah, on the beach. But anyway, I did that for 2.5 years, and then I moved to London for my second postdoc. So I was at the Francis Crick Institute, which is probably the largest research institute now in the UK. And I was doing malaria again, and that meant I got to spend time in Kenya. So I would spend the winters in Kenya and come back to London for the summer. So
you really had it good. You lived in London, it was cold.
Yeah. So I mean, I didn't plan this. I mean, good things happened to me along the way, and some things were not good at the time. When I had to switch labs, that felt like I was wasting time. I was losing 2 years of my life. Now I look at it, it was perfect because I learned how to grow malaria in the first lab, and then I learned a whole bunch of T-cell stuff in my new lab. But anyway, to cut a long story short, now I'm in Ghana. After doing 2 postdocs, now I have my own small group. I've landed back home, which is fantastic. I'm at a place where we can do really great science, but I'm already looking at what is my next challenge. And for me, that is probably in biotech. I'm in the process of starting my own biotech company, which is exciting and scary at the same time. Right. But I won't give up academia. But for me, the journey has been one of taking the challenges and turning them into learning opportunities. And then always striving towards what I knew was my original goal, which was to establish myself as a researcher in Africa, working on diseases, on conditions that affect people like me who are from Africa. And so I've managed, taking a windy road, I'm finally doing that. I'm studying malaria in children right outside. I'm looking at cervical cancer in African women, and I'm really getting to live my scientific dream. But the journey was one of a lot of the self-discovery, and it changed me along the way. So,
thank you. Anyone else?
I'm happy to piggyback on that when you're talking about self-discovery. I think that speaks a lot to my personal journey. Moving into my postdoc, I was very much on the traditional path of focusing on academia and wanting to be a professor. I transitioned into an IRACTA program, which is an NIH program for postdoctoral fellows that want to gain some additional experience in teaching and pedagogy in order to transition into academic positions. And I worked with a wonderful group at VCU with Dr. John Ryan and his lab. And during that time, I actually was exposed to industry and biotech, and someone actually approached me to expose me to the medical science liaison, or MSL, career path, which to that point is not something that I had previously heard of. And it took a little bit of self-discovery on my part to understand sort of what are my strengths and what are the things that I enjoy. And that for me was communicating the science. That for me was also strategic thinking, so study design and sort of that approach, and maybe not necessarily as much feeling like I had to be at the bench myself in order to feel fulfilled in my day-to-day obligations. And that was a really hard sort of moment of self-discovery, but I did end up making the transition into the MSL career path. And from there, having a wealth of experience within medical affairs and across industry and different therapeutic areas. And I've thoroughly enjoyed it. And what I do in my current role as Associate Director of Medical and Clinical Affairs is really bridging the gap between what we do on the clinical side, so focusing on our clinical trials and our investigator-initiated studies, and how does that align with what we do on the medical affairs side? So how are the MSLs helping physicians understand that clinical messaging? And so I think for me, it's a chance to not only impact the science, but also to work very closely with the people, which is something for me in terms of job quality and overall satisfaction. Working with people was very important. And so I think I'll hit the nail on the head by saying it's self-discovery. I think it's all random, but you really have to be honest with yourself about what it is that you enjoy in order for you to find your passion, and you'll never feel like you're working a day in your life.
Thank you so much. Layal.
Super inspiring.
Right.
Yeah.
I was like, I
I
know you wanted to say something.
Yeah, sure. I can also like give a quick summary about my career so far. So for me, it's a lot more recent, I think, because I just defended my PhD at the end of last year, and then I made like a quite dramatic change and decided to move into journalism after graduating. So I think like it started maybe like during the later years in my PhD, I became quite interested in communicating science, and I was doing a lot of outreach activities. It was partly kind of related also to the fact that I saw that there isn't that much diversity in science, at least where I was. I was at the University of Oxford at the time. And I was thinking, yeah, I got quite involved in doing like outreach activities, a kind of science club for kids on the weekend that I used to volunteer at, because I thought it's nice for people to see like the diversity of people who can do science as well. And through that, I started to realize that I really like actually communicating science, and I got into writing, and I realized I actually like it a lot more than doing research myself. And so in the last year of my PhD, or actually the second last year, I went to The Guardian to do a kind of short placement on the science desk, so writing science news stories. And I found it really exciting, and I kind of developed a few mentors there. And I think then for the last year of my PhD, I was already kind of thinking that I would like to move into maybe science communication or journalism. But to be honest, I was very lost because I didn't know anyone who does that kind of job. I didn't even know like how I could do that. So I just kind of started going to careers events, actually like the one that we're doing right now, and like listening to what other people had been doing. And then eventually I applied for a diversity internship at New Scientist. So they were running a scheme coincidentally like the year that I was finishing. So I did an internship there where I learned so much about doing science journalism and training. And then now I'm still working for New Scientist as a trainee digital journalist, so still writing about the latest science and technology news. And yeah, my PhD was in infection immunology, so it's been particularly relevant at the moment, reporting on coronavirus and so on. Yeah.
Thank you. Last but not least.
So I'll chime in real quickly. So one of the things that I want to point out here is that what you see is that at some point, immunology sparked a fire in us. There was a hook that brought us in. And throughout this entire process, and for everyone else for your career, you want to have them be open and understand those opportunities as they come along that touch your passion. So for me, after finishing graduate school, I wanted to do back for a sec. So I wanted to go into industry, and frankly, I didn't actually have enough exposure and to understand how to actually get there. But I also wanted to spend some time doing some work because at the time there's a lot of conversation about bench to bedside. So I landed from Central PA over to Philadelphia at the University of Pennsylvania, working in a lab that was doing translational research as we learned to design experiments from the bench and thinking about the continuity all the way to treating a patient, at least in a clinical trial. And so, having an opportunity to learn and get that experience. But an interesting thing happens, and happens to some people, and it happened to me, is that our program happened to have a CAR T cell trial that splashed really large. So now all of a sudden I have this huge skill set that is in high demand. So from there, I transitioned from being a postdoc to working in an industry position, worked there for, I think it was a couple of years there, and was really a bit more focused on CAR T cells on the industry side. And from there, pretty much, everything that we were doing had two key purposes: developing IP or getting these trials started. But there was still a little something missing there. And for me, it was more like the interaction with people. And one of the things about industry is that you interact with the people you work with, but you can't be in those environments where it's not like academia, where you're working with people across campuses and doing a lot of broader collaborations. They're a little bit more controlled. So from there, I actually interacted with a guy who helped us with some equipment that we had. And I was like, wait a second, you get paid to go around and teach people how to use this instrumentation and and you also get exposed to a broader range of science. And so move from there to the current position. So luckily, I just spend my time working with people and helping them improve their science, helping them, move their clinical trials from the R&D phase through clinical trials and also the commercial. So basically, it's this wide range of experience that is connected to my own skill set. But also the other thing is I get to learn a wider range of sciences, from looking at yeast to various things. And throughout that entire process, it's, part of preparing yourself for it, taking advantage of career development opportunities, but also not being so focused on what you're doing. I think is difficult, because the way PhDs programs develop is that we get so narrowly focused. But being open enough that when opportunities come along, you kind of go, oh, that sounds interesting. And you also saw in the other conversations that other people recognize certain skills in you, and for you to be open and available for them to have the opportunity to say, hey, have you thought about this? And then for you to shift directions and be able to help them. So that's not quite my career path, but I just wanted to have a crystallizing conversation about it, because, well, I'm the last person. So let's take all the great information that everybody else presented and put it together. So that's it.
Yeah, no, and thank you for that, because I think that is, you all kind of touched on some important points about the PhD journey. I mean, for one, it is a journey, and it is a journey of self-discovery and a lot of other things. But I wanted to kind of ask you, what do you think, what is some really crucial or key skills that you think that you learned during this journey, like through your graduate degree, that really helped you with your career today?
Can I chime in first this time?
Go ahead.
So, all right, so I'll talk again. So I would say, think about it. What I try to do is what eventually happened for me was I said in a talk, but I also started thinking about, like, what do you learn as a PhD? You really learn how to think. You learn how to find information. You learn how to find out who you need to talk to get the information you need. Who do you need to build relationships with to get your projects to move forward and develop your career? So think about those skill sets. Now take them, transfer them, superimpose them on a job search. What type of job do you need to learn? So things like, I want to work at company X. Who do I know at company X? Can I get them to give me an internal referral? What kind of, can I get some information on a informational interview? And so those are the point that I'm making here, and to quickly make it, is you have built a number of skills from 4 to 7 years or whatever period of time it takes for you to get your PhD. Utilize those skills. You have them, but the key is unlocking those skills and understanding that you can reapply them to the job search and thinking about what you need. So that's my portion of it. I'm listening.
Yeah, I think adding to that, a lot of what we do throughout the PhD journey, to his point, is very transferable across the different types of careers that you might pursue. And so one of the most important that I can think of is really highlighting or exercising that muscle of communication, because that's what's going to be really important across any of these careers that you pursue. It makes you very valuable when you're someone that not only can be very strong technically and can tell me about the CAR T cells, but if you can tell me in a way that meets me where I'm at and that I can understand, that is someone that becomes invaluable in their career path. And so I think communication is going to be one that's important, but also something that Dr. Wilson mentioned around that thinking. Do you bring that strategic vision? Are you able to perhaps highlight gaps that people may not notice? So I think making sure that you can highlight those two specific skills is going to be important and serve you well across any scientific career that you may pursue.
Yeah, I completely agree with all of that. Like, I think a really common interview question, for job interviews is like, oh, can you tell me about a situation where you were outside of your comfort zone or where you had to deal with something challenging? And I always laugh when I get that question, because I think my entire PhD was just all kinds of unexpected things. You always have a nice project in mind. It doesn't turn out how you expected. You have to adapt, you have to pivot, you have to know who to contact, who to go for help, how to communicate with them, to explain your problem. And so I think all of these skills are really, really beneficial in the workplace in lots of different careers. In the context of my job, it's been super helpful to have contacts like who are scientists, because I spend a lot of my time, interviewing researchers, trying to find out what the latest studies are that might be coming out and getting expert opinions on those. So I think just learning how to actually interact with and talk with scientists, with academics during my PhD has helped me enormously now, like as a science journalist in particular.
Yeah, I mean, if I could just add to that as well, I mean, I think it depends where you end up, right? Which skills you tap into. I mean, obviously, those of us who have stayed in academia, writing is extremely important. Writing grants, writing papers, teaching your students how to write. So those are skills, I think we're all talking about the soft skills. And the funny thing is when you're in your PhD, you're focused on, I can do this technique in the lab, or I can do that technique in the lab. But in reality, by the time you have your own group, those techniques are old school. I mean, it's like, the science moves so quickly that what I think a PhD really helps you is it trains your mind to be able to assimilate information quicker than the average person, and to know very quickly, to make decisions very quickly about which bits of information you should store and which information you should discard. And I think that's really what a PhD brain does. I mean, when I was at Northwestern, consulting companies like McKinsey would come trying to recruit us. They're not coming because they think I'm a good immunologist. They're coming because they think I have a good brain. They'll put me to work. They'll put me through an accelerated executive MBA program, and I'll be talking to people about insurance or whatever it is I need to talk about as a consultant. So I think as students, my advice would be, yes, in your project, your supervisor definitely needs to make sure you know how to do flow cytometry or RNA-seq or whatever it is you're doing. But when you finish your PhD, it's less about those techniques and more about the soft transferable skills that will determine where you go, whether you stay in academia or you go into industry or you leave science altogether or you're a science journalist, whatever it is you do. What is actually more important than what assay you know how to do, because there are protocols. I mean, you can give me a protocol and I can do an assay. There are certain things that you need a little bit of training on, but that's not really the difficult part. The difficult part is planning the experiment, thinking critically about why am I doing this, reading that paper and gleaning what is important. So I would encourage students to really try to hone those soft skills as they are honing their technical skills, because it allows you to be versatile. I think if you look at this panel, if we've had any success, it's probably due to the fact that we are versatile, that we can adapt and we can switch direction. And that all comes with the fact that our brains are, haven't sort of become fixed in one area, but they are malleable and they are adaptive. So that is the biggest thing. When I talk to my students, I try to help them to think about, when you're done with your PhD, the specific project doesn't matter. You can study malaria now and you can end up doing something completely different, or you can leave science altogether. But if I've taught you anything, I hope that I've taught you how to think critically, how to write critically, and ultimately how to take information around you and make good decisions. And I think that's really what a life science PhD, a good life science PhD does for you.
Yeah, I want to underline everything that's been said. I think that's fantastic information from those of you who are closer to probably our audience than I am. But I also want to maybe push on what Yao said about soft skills. I mean, we're all referring to that, but I wouldn't call them soft skills. I would call them skills. Because they're skills that we all need. And one of the things we did here is I was PI of a program called Broadening Experiences in Scientific Training at Cornell called BEST program. And the idea was to do exactly that, open the possibilities for our graduate students and postdocs so they can see careers that are available outside of academia. And one of the underlying messages of that whole program was that everything you do is part of your training. Whether it's in the lab, whether it's volunteering in schools, whether it's doing outreach, all of these things are important because all of these things you can leverage for the next thing. And this is what I was referring to when I said my walk was a random walk. So that you do all these things and then you collect these things that you've done and you say, how can I use them in the next phase? And that is what a PhD, as you say, Yao, and all of you, that's what it means, is that training to be able to do that.
Thank you all so much. I mean, yeah, I feel like I'm learning so much here, just, hearing all of your stories and all your journeys. And I think it's, super important that I think while you're in the PhD, it's emphasized and, the hard skills, the technical skills that we have to, make sure that we have down to, for me, I think that, I'm at the University of Chicago, we do talk about the academic track a lot, but we do promote like learning about other careers as well. But I think it's so important to learn about these other skills, how to communicate your science, how to, learning about just how to apply science in different ways. And I wanted to ask you all a question in terms of wherever, I may end up, or whoever is watching may end up career-wise. What is your strategy for developing relationships and advocates for, your next step or whatever? Because I know for me, sometimes I've had trouble with, adapting to this environment, like academic wise, just trying to understand different people's cultural background, and people also trying to understand my cultural background and my experiences as a Black woman. So what is your, strategy for, getting people to understand who you are and develop relationships to help you get to the next step?
Or maybe I can start and others can add. Actually, before I was thinking after we finished the last topic, one thing I wanted to re-emphasize was what Dr. Baker was talking about networking. The further along I go in my career, I find it's less about what I know and who I know. I mean, we joke that that's how life works, but in science, it's actually even more prevalent. As I've gone along, the big opportunities have come for, like my current position, my previous postdoc. It's always been about meeting that person who has made that introduction, because there are lots of young scientists coming up. But if you get a seasoned person to say, oh, this is Yao, and I think you should talk to him, it opens doors for you. And in a way, it's not fair, right? I mean, but life is not fair. So, and as a person of color, that is even more important. At my postdoc at the Crick, I was one of very few Black men. I mean, even at Northwestern in Chicago, a Black city, when I graduated, there were a handful of Black students, and being a Black man, that's even proper minority there. But what struck me was, at the time, the dean of the graduate school was an African American, and I didn't know that. I'd never been up to Evanston. I was always the Feinberg campus downtown. But it felt so good to receive my degree from a Black man, and that meant a lot to me, and I'll never forget that experience. It kind of shocked me because I didn't know who he was till he handed me the diploma. But it's about networking, and it's about creating. There's a book called My Personal Boardroom, which I recommend for people to look at. And it basically talks about different roles, different people you need to surround yourself with. And some people are in power roles, they're unlockers. They're senior people, professors, provosts, very senior people who can sort of make introductions for you and open up certain areas. There are other people who help you develop. So they call you out on, when you're not really doing what you should be doing. They can be a, encourager. And so there are different roles that people play. And it's really about constructing a really solid network of people around you. But I would encourage students, it starts with putting yourself out there. You have to be, I think science can help us do this because we have to give presentations and talks all the time. It hopefully builds a certain amount of self-confidence. But in my journey, if I compare myself to some of my colleagues, I've gotten where I've gotten because I've not been afraid to stick out my hand and say, hi, my name is Yao, I do this, and break the ice. And it's difficult sometimes, and you're in a room full of, white men, or people who don't look like you and are not interested in talking to you. But if you put yourself out there, in my experience, not everybody's interested, but you will find those people who will be struck by your confidence. My first postdoc I got because I sent an blind email to the director of the program in Kenya. He's a British professor from Oxford. Name is Kevin Marsh, one of the most famous people in malaria. And I found his email address, and I composed the best email I I attached the CV, I attached my CV and I said, hey, I'm a Ghanaian, I'm studying in the US, I want to study malaria in Africa. You have the best place to do it. How do I get to work with you? I mean, I never met him, no one had ever introduced me. Down the line, he opened so many doors for me. And I think it was because he responded to the fact that I'd made the effort. He flew me, he paid for me to fly from Chicago to Kenya, put me up in a 5-star hotel to interview and flew me back and then called me on the phone the next day and said, you've got a postdoc. Now, not everybody might have that, but that would not have happened if I hadn't sent that email and chased him for the next 2 years, So anyway, I think build a network and don't be afraid to put yourself out there, because if you're not your number one champion, who should champion you, right? I mean, you've got to put yourself out there and be confident that you have something to offer, and don't be shy about it. It's not about being cocky, but it's about being quietly confident in your abilities and that you have something to offer.
I agree completely.
Oh, sorry.
No, I was just going to say, I agree completely. I think being proactive and advocating for yourself is important, but networking is going to be one of the key things to success across all of these different various careers. I think about myself when I wanted to make the transition from my postdoc into industry. It actually was a Black woman who I reached out to and said, hey, I see you're currently doing what I think I want to do. Would you talk to me? And she ended up being someone who helped me, turn my CV into a resume, helped me develop a cover letter, and even did mock interviews with me. But that wouldn't have happened if I had not proactively reached out to her. There are people that want to help, but they don't know unless you raise your hand. So definitely be proactive in seeking that networking. But also, when Yao was touching on the types of people that you need around you, make sure that you have mentors and sponsors. So mentors being the people that can really help you develop your skills, or you can bounce ideas off of them. But sponsors are the people that are in those higher positions that really, they're in the room where it happens, and they're the ones that are empowered to bring your name up and can open doors and create opportunities. And they're willing to be your sponsors if you seek that out. So again, being proactive and networking, I don't think we can emphasize enough how important that is for us. As being Black in Immuno, but also, across the board, it's just an important skill set to have.
Yeah, definitely. And I think people really want to help as well. I think at least that's how I feel. I do my best to reply to as many, when people message me on social media, they say they want to go into science or journalism, to try and answer their questions. And I think a really good strategy, because it's something I do as well, I also still reach out to people who have more experience for advice. I think a tip for someone, maybe some people are listening and they're thinking how do I do that? Or how can I approach it? I think a really good, or two really good starting points. One, I think, is asking people for advice. So maybe it's a bit, I'm British, so I'm a bit indirect, but I think it's great to reach out to someone that you admire and just tell them that you admire what they've done, their career path. You're really interested in getting into that field, but you're not sure how. Do they have time for a quick chat? And could they give you some advice? And you could just attach your CV as well, maybe ask for feedback or advice. I think it's a really good entry point to start a conversation, rather than just saying, oh, give me a job, you don't know me. But you can kind of just start that as a way to have a connection with them, and then they might remember you later on. I think that's a good entry point. And yeah, I think also just maybe if you attend events or virtual careers events or things that are happening at the moment a lot, then it's great to kind of ask questions if you can, and try to engage with the speakers to kind of show that, you're paying attention. I think people tend to remember people who kind of ask questions in seminars and events. I think that's also a really good way to, and I'm sure you do have lots of questions and maybe you're shy to ask. So I would kind of say, just don't be shy. I really don't think there are stupid questions. I think it can only benefit you, and people really want to help and are really flattered when you A, ask them questions, or B, ask them for advice, right? So I think it's a really good approach for networking.
And I think you all kind of brought up a good point about, the networking aspect. This is a muscle that you kind of have to develop over time. I mean, for me, I'm more, I would say that I'm more introvert around people that I don't know. So it's really hard for me to go up to someone and introduce myself, or, send that email that, just establish that contact. Have you all experienced any sorts of anxiety like that? And if so, how do you overcome that?
No, go ahead, Caleph.
So I would say, yeah, the anxiety part is hard. I think everybody has their different personalities, but one thing I want to touch on is maybe think about not necessarily on how to get people to accept you, but are you comfortable being yourself, right? Because the truth of the matter is that's just life. Regardless of how well you are as a scientist, how well you are doing as a graduate student, there are going to be times where people are just not going to connect. So if you're comfortable where you are, your culture, things that you're doing, the people who gravitate towards that and can accept that will be people you will have success with, you'll build relationships with for the networking, right? So also think about all these people you're in graduate school with, your committees, all these folks will 10, 15, 20 years from now will be people that will be part of your network and people that you know you'll hopefully keep lasting relationships with them. Yeah, so I just wanted to touch on that. But the anxiety part, I think it's like anything else. I forget who mentioned this, but it's the using that muscle, right? So if, for example, if you have difficulty maybe talking to people in the crowd, hey, the next time there's a recruiting event, say, hey, I'm going to walk up to at least 5 different recruits, or if there's a career fair, I'm going to go to 5 different booths. I'm going to have a list of questions. I'm going to talk to these people, and I'm going to work to become more comfortable with actually engaging. But the other part about it too is let's just pause and think for a second. We have a wide range of backgrounds. My background is like, I grew up in Mississippi. So, you have whatever thoughts you have about Mississippi, it's like, but I was able to move forward with a lot of assistance. Now, think about all the things that you've done. You're outstanding. You're great. People should actually want to talk to you. That's maybe a mental thing you should think, like, hey, they should want to talk to me because I'm interested in them. They should be interested in my background. And find those little keys that help you move past the anxiety and get done what you need to get done.
Also, just remember that you belong like in this space. Like there's no hierarchy. It's like you deserve to be here. Just kind of echoing what Caleph said. Like I think sometimes there's this feeling like as if a scientist is a certain type of person, or I think this is rubbish. Like anyone can be a scientist, and if you have the experience, then people would love to talk to you and learn from you. And so just remember that. I think that's something that I had to remind myself of a lot, like during my PhD as well.
Real quick, I just said, just think about the people that have your back, right? Yeah. You guys plan this event, and I guarantee you there are people that you know, probably your aunts and uncles, your parents, like all those folks who are excited to learn that you're doing great things. When you start doing stuff, think about those folks that have your back. Go get it done.
Thank you.
I wanted to jump off that point and maybe add a bit of a something of a different lens, which is, I love the idea of exercising your network muscle, muscling network, or whatever the term is, and the fact that, Layal, I think I'm glad you brought that up, which is you've done what you need to do to be here. I mean, you shouldn't question that at all. And so this idea of reaching out and talking to people, and what I do get worried about is because of the networks that influence so many things, as Yao said, that we need to ensure that we play a role in broadening those networks so that more people are part of those networks. So rather than just saying, okay, there's a network that exists, I'm going to put myself into that network and not worry about broadening it. We need to broaden it, because part of the way those networks have worked is they've excluded people who look like us for so long. And so we need to make sure that we broaden those networks so that we're no longer excluded. So I just want to make sure I put that in there as well.
Thank you. Yes, thank you so much. And another thing that I think I wanted to, someone had asked on Twitter, and I think is just super relevant to me as well. When I entered, a lot of people who go to get their PhD, they enter, maybe with the intention of going the academic route. But, I don't want to speak for other people's experience, but I know that, this academic environment can like burn you out. And it could be a lot of work. So someone had asked, is there any advice or do you have any advice for anyone that, is fighting the guilt of possibly leaving academia and considering other career paths?
So maybe I'll jump in here as one of the probably the longer serving academics on the panel. I actually I didn't talk about this, but after I finished my postdoc, I actually worked in industry. And, it's a great place to work. Obviously, many of us are alive because of work that comes from industry. One of the reasons that I went back to academia is that I really wanted to work with students. And so for me, it wasn't necessarily that I wanted to be in industry, academia, or government. I wanted to be in a place that allowed me to do the things I wanted to do. And so I think if you keep that in mind, it helps get you through those, the middle of the PhD where you're like, I'm going to leave this place. I just can't do this anymore. Or, the middle of that postdoc where you're just not sure what's going to happen. Thinking about what it is that you want to do and then find a place that will allow you to do that.
Yeah, and I think it also comes down to something that I mentioned previously is there really is no dark side. You're not crossing over. You're just choosing to do something that aligns more personally with your interests, right? So it all comes down to you really have to evaluate what does the ideal job look like for you. And does that more closely align with what you can do in academia, or does that more closely align with what you can do in industry, or is it something, completely different altogether? I think you have to really honestly reflect, because if you choose one or the other and it ultimately does not make you happy, you'll end up back at square one, where you're miserable and you're thinking about what can I do differently. So really taking that inventory of what you want your day-to-day to look like, and moving forward based on that. There is no right or wrong.
Yeah, I would echo that and say also that I think you're more likely to succeed and do well if you're doing something that you love, something that probably you're good at it too. It kind of goes together. I think I definitely felt really, at some point during my PhD, not that long ago, I was feeling quite lost about what I wanted to do. And like, I want to do journalism. It's like, what is journalism? Like, it's just like, I didn't know how to do that. And it seemed like a really drastic change. And it's like, but looking back, I'm so happy that I've made this decision. And it's like, I have no idea where I might end up in future, but it's like, I'm happy that at each stage, I'm following what I wanted to do at that stage. And then I'm sure like in 10 years, I'll look back and tell the story as if it was all planned. But I think, yeah, just follow your heart, do what you love. I think it's really important.
So
I mean, sorry. Go ahead.
Yeah.
I was just going to say, I mean, I think, we all get dropped into us that going to academia, going to pharma is like the dark side. And the only people who say that are these professors in academia, I mean, many of whom actually, if you dig deep enough, have a pharma background, so I think what's important, like Layal said, is to focus on where you feel you are at that time. I think it goes back to what we said at the very beginning. Your PhD makes you extremely versatile. So use that, take advantage of it. You're in the top, 5, maybe even less % of people who have such a broad skill set. So if you're tired, I took a break after undergrad. I took a break after my PhD. I actually went to teach. I didn't do any research. I just taught for 2 years because I felt burnt out after basically 2 PhDs in one. But after 2 years, I was like, I really want to do research. This is what I'm good at. I want to do research. And then I began to think, okay, so I went the academic route for a while. But now I've achieved the academic, now I have a university position, and I've got one step out again, because now I'm like, what Ghana needs is biotech. Ghana has universities. I want to be that guy who starts that unicorn biotech, or zebra corn, as we call it in Africa, biotech company in Africa. I want to be, the Genentech of Africa. So now I'm like, I'm going full. I mean, I'm going to the dark side. I don't care, but it's not dark, because it is what I want to do, and I get to create something new. And if I do that for a while and decide I want to come back and teach like Professor August, fantastic. I actually hope I can still maintain some students as I'm going down this new journey. So I think my thinking about this has changed. When I was in grad school, I thought going to pharma was like Darth Vader, like I've sold my soul to the devil. And now I'm like, how that was completely wrong. It's not. We need both sides. And biotech and pharma are very, even within that, they're not homogeneous. You can work for Pfizer or AstraZeneca, which are huge giants. You can work for a biotech company that has like 15 people and is really a startup and is doing really exciting stuff. So even within the non-academic route, there are lots of different areas that you could find yourself in and do really cool stuff. So yeah, I think that the refrain is do what you feel you are meant to do, what makes you happy at that particular time, And don't be afraid of change. If after 5 years you want to do something else, you can do it. You've got the skills. Just apply yourself and do it. You know?
This is like the part of the conversation where you wish you could like keep talking forever over beers, right? So let's just think about this. If you're going, so first of all, at its core, PhD is an academic degree, right? So that's why it's trained that way. That's the way it's set up. However, let's think about the other side. Are there enough faculty positions and research funding for every single person who has a PhD? The truth is, it isn't. So what does that mean? You have to decide if that's the track you're going to take. If it is, go full bore, do what you need to do, get it done. However, if that's not the route that you want to take, how do you actually find people that can help advise you on a different path and help you understand what your passion and interests are? So if it is industry, biotech, consulting, journalism, whatever, academia, whatever it is you want to do, find those people and work with them to develop that. But the other side, I try to look at it from, because I have policy fellows, so I try to look at it from also a policy background. Here's a reality. The truth is, if you've been a graduate student, you understand the starving student lifestyle for a period of time. If you don't want to do a postdoc, go on and do something else. But at the end of the day, you need to be able to make money to take care of yourself. There's a lot of time, energy, and resources that have been put into you to help you get this degree. At the end of the day, are you able to make a living? And also, how can you contribute, and give back? So find your passion. Don't. And then one thing I'll say for anyone who's out there who's considering graduate school, think about the programs you're applying to and ask those questions about the broader things that you may want to do and understand whether that program or that institution allows that, right? So if the institution is not cool with it, the program's not cool with it, but hey, I'm interested in consulting, but I'm afraid to tell my PI or tell somebody that. How successful are you going to be in your program if you're afraid to have people understand exactly what you want to do? And also at the postdoc level, hey, you're a doctor, whomever. If you're applying for programs that don't want to allow you to have this broader experience, that's probably not the program for you. You much rather spend your time being happy. That's the other side of I won't say the other side, but the point of all this is, how can you complete your degree? How can you do your postdoc? How can you go, whatever it is you're doing, how can you do it and be as authentic and happy as you can? That's the key thing. If you're not, you're going to kind of fake it for a while, and at some point it's going to blow up on you. Be happy, be who you are, get it done, and use platforms like this to find people that can help you and advise you. And one of the things that you will hear in this entire thread is there's always someone that has helped us. Like, for example, Dr. August was actually on my thesis committee and helped me out a lot when I was in grad school. So I was probably considered a bit of a knucklehead grad student. So to have people help you get to where you need to go is critical. But for all of us, this expanding area of immunology, or a group of people, like, we're always here to help. I look forward to getting a tweet or email or something that somebody says, hey, can I ask you something? Yeah, I'll find some time to talk to you. So that's my point about that.
And thank you all. Thank you all so much for that. Like, it's hard. It's hard being Black in immuno. It's hard being Black in science in general. I mean, there's a lot of social difficulties, as well as, just the process itself is hard. I wanted to ask you this last question before we get off, for people who are in various different, I guess, stages of, the academic track. What do you think is just so important for the retention? What do you think is important for contributing to retention of more Black scientists in this pipeline from undergrad to grad to, beyond, whether it's going to be academia, industry, or whatever?
Thanks for that question, Yumi. I think I'm glad you asked that question, because one of the things I've been thinking about a lot is exactly that issue. You could do, several hours of this, and Caleph says, you can continue this discussion. The important thing I think about is, what environments do we find ourselves in? Is that environment one that we want to be in? If it's not, I don't blame students for not wanting to be there. I don't blame postdocs not wanting to be there. I don't blame people from not wanting to go into academia. But I do want to make a pitch for academia, because one of the things that we've been hearing a lot about, and I'm agnostic, and you do, I've been saying, you do what it is that makes you happy. But one of the things we've been hearing is we don't have representation in academia. And the only way we can get representation in academia is for us to be in academia. And so I do want to make a pitch for that. So if it's one of the things that drives you, it's your passion, do it. There are no careers that are ideal. There are days when I get up in the morning and I'm doing things I don't want to do, but I do more things that I want to do than the things that I don't want to do. And that's the thing that keeps me happy in academia. And I'm sure each of us in this panel can say the same thing for our own. I hate writing grants. I'll just put that out there. But I've been in academia for a long time. And I still don't like writing grants, just to say that. But culture environment is so important. And we can do all the things we want to do about building pipelines, programs. I've done those, others have done those. But if we find ourselves in environments that we're not welcome, we won't stay. And I think that's the message that I would like to send.
Yeah, I mean, I think I would just like to piggyback on that as well. Like I said, my own experience, being one of a few Black men in my department or in my program, I think, as we talk about networking and about expanding the network, we each have a responsibility to pay it. We've had certain opportunities, and we have a responsibility to try to make it that little bit easier, maybe, for the people who are coming after us. So I'd say, each of you, whoever listening, we've all achieved great things. We've all come from different circumstances, and we each deserve to be where we are by virtue of how hard we've worked. But I think we mustn't forget where we've come from, and mustn't forget perhaps the struggles we've been through. And sometimes that's what makes it worthwhile, is knowing that having your face there, that's why I'm doing this panel, right? Somebody will see me and say, oh, okay, if he could do it, then maybe I can do it too. So I think wherever you are, whether you're in academia, because we don't have representation anywhere, right? I mean, besides, it's like there are certain areas of society that are deemed fit for Black people, and others that, it's like, oh yeah, so wherever you are, I think you have a role to play. I'll just give a quick example. In January, I gave a seminar. I was teaching a course in Ethiopia for African students, but it was organized by IUIS, International Union for Immunological Societies. So the faculty was predominantly white and European. And I was younger than most of the faculty, and I'm Black. So of course, when I got there and I was checking into my hotel, the organizer, who is a white European woman, professor, came up to me and told me I was checking into the wrong hotel, because that was the hotel for faculty. This is January. This is not like, like 1990. This is 2020 January, like just before COVID made everything difficult to travel. And she was like, and I was like, oh, I'm actually faculty. I introduced myself, and she actually knew my supervisor. Like, oh, okay. So I was like, okay, fine. Later that day, we were sitting in the hall for the conferences. All the faculty were sitting in the back, typing on our laptops. And somebody came up to me and said, you need to be further forward. You need to be, because the students are at the front. I was like, no, I'm not a student. It happened to me 3 times in this same workshop in Africa, right? It's not in America. I was being discriminated against in Africa by Europeans who were supposedly coming to teach African students. But I didn't, I bore it because I was surrounded by African students. They were more interested in talking to me because I reflected I reflected them. So that was why I put up with that. I gave my talk on the 3rd day, and after that, all the faculty were trying to invite me to have lunch with them. They hadn't invited me the whole time, but once I gave a good talk, all of a sudden I was worthy. And so they were like, oh, come sit with us, Yao, and blah, blah, blah. Can we collaborate? We want to work with Ghana. Can we get samples? Yada, 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 right? But I'm just using that as an example to say there will be times when this stuff happens. It happens to many of us. I'm sure there are even more jarring stories. But the reason why I think I am supposed to be there is seeing my face. I don't care about these European professors. It's about the students who were there, who were chatting with me every day, asking me questions. What should I do? What shouldn't I do? How do I get where you are? And that makes it worthwhile. So I can put up with all the nonsense because I know that I'm actually having an impact on these students. And I think wherever you are, whether you're a student, we're all role models for somebody, right? And it's about being the best role model you can be, because you have no idea how your story is going to, motivate and inspire the next Bill Gates or the next, You may never know what your story has done, but one day somebody will get somewhere and be like, they heard Yao Bedaiko talk and they were like, I want to do something. So you are more powerful than you know. And I think Black people we need to embrace that power, because, the experience of the Black person globally is one of challenge, but also one of extreme excellence and extreme achievement. So I encourage anyone, Black immuno, Black physics, Black whatever, be proud of who you are and know that someone is looking at you and is inspired by you. So.
Thank you so much for that.
Also, I would just say, remember that you're not alone. This whole Black in Immuno initiative has just been amazing. Seeing on Twitter that there are just so many other people. I just spent a lot of my PhD thinking I'm alone here. I'm the only Black person in the room. So I really loved this experience. Thanks so much for inviting me.
Yeah, no, I agree. And I'm so happy that, there's been this wave of just Black in, not only Black in immuno, Black in neuro, Black in micro, just a lot of different waves out there of just showing us, all the different Black scientists, you're not alone. And I think that's just super important. It helps you to keep going and keep things in perspective. But we are out of time. So I just want to thank you all so very much, honestly, so very much for coming here and, giving us your time and your energy and your advice. So with that being said, that is the end of our career panel for Black in Immuno. Stay tuned for the adaptive immunity talks today at 2 p.m. and enjoy the rest of your day.